Dzień dobry Państwu. Dziś Miodowa 15 z siedziby firmy Johnson & Johnson.
A naszą gościnią jest Geraldine Schenk, Country Director Johnson & Johnson Innovative Medicines Poland. Hello.
Dzień dobry.
Dzień dobry. Do you know what is this Miodowa 15? What the address?
Yes, I know the address, right? It's the building where the Minister of Health has the office, right?
Have you been there?
I was there, yeah. I was there 3 times, and I had the opportunity to meet our Deputy Minister, Kos, and his predecessor, yeah, it was a very, very enriching and very fruitful discussions that we had there. Yeah.
Yeah, because now we have a very interesting time, and we are seeing a very strong acceleration both in terms of development of medical data, dosage, and AI on the other hand. But this is, on the one hand, seems to be a benefit for patient, but there are growing concerns about the security. And this is the point to choosing what we have to do in Europe to have a balance. What do you think about this?
Yeah, and I think that's it's a very good question to ask, right? I mean, on the one hand, we have so much data available that is currently not used. But on the other hand, this data is highly sensitive. I mean, we talk about medical data of patients, and I think therefore the question is, what would be the right frame and what would be the right guidelines to handle those data properly? And currently what we do here at Johnson & Johnson Innovative Medicine, to us it's our utmost priority that when we get access to this data, that we truly handle them according to the legal environment, but also according to the environment that this data will be treated in the right way, because as I said, it's very sensitive. What can we do here, right? I mean, to me, firstly, it's really to build the trust between the different parties, because there are different stakeholders that need to collaborate, right? We have not only the pharmaceutical industry, we have the diverse ministries, they have access to this data, right? And how do we process this data? And I think we are literally here a little bit in the forefront to approach those people and those relevant stakeholders and those institutions to have a very constructive conversation and debate. How should the future handling of this data look like? Because you mentioned it, artificial intelligence can help us to accelerate the access to for patients getting the right treatment, but also it will accelerate the innovation for the patients and getting new treatments.
But it's the question, who is the owner of the medical data? Because it's my medical data, or it's the for business, or it's for the benefits of my health.
That's right. This is a really key question: who owns the data, right? Because firstly, I think it's the patient's data, right? This data belongs to the patient because these are very individual data. So therefore, it's very important to get the consent of the patients first, that we can handle and we can process this data. Secondly, of course, it's also data that belongs to a certain healthcare system, because this data is stored on servers, on you name it, databases, and these are belonging to the national health systems, right? So therefore we also need to work and to agree how can this data be stored, and even the patient needs to agree that his or her data is stored on those places. And then we need to further agree how this data will be processed. So it's a little bit of a multi-stage collaboration that we need to look into it. But I think this is truly a very critical debate that we need to have. Firstly, who owns the data? And then what is the right way to process this data and give this data make this data accessible, right?
And Polish regulation doesn't require consent to when you use healthcare system. So it's also very interesting. As you said, this is our data, but it's also a part of the system.
Exactly, it's part of the system, and I think the system also benefits from them, right? Because we all know the costs on healthcare system is currently a very top of mind debate, right? And I think when we have this access to the data, this can also help to manage the cost burden related to healthcare systems. Because if we can, for example, give access to the data and we can link this with algorithms that are supported by artificial intelligence, this helps us to really process a vast amount of data, and therefore we can accelerate, firstly, research and development. It can speed up how we conduct the studies, but more importantly, I think we can go into that direction to go more towards a personalized medicine, because we know currently it's a little bit one size fits all, but we know every patient, every human is individual. And I think when we have this access to the data, we can identify certain pattern of a disease progress, how diseases are progressing. Are there certain subgroup of patients that need a specific treatment? And I think this will help us, right, to individualize the treatment, which leads us to better healthcare outcomes, better treatment outcomes, less time to recover for the patients, and a better and earlier reintegration into the work life.
Right, we're going to ask about these matters, but I would like to ask about the business side of using AI. So companies around the world trying to find the benefits of using algorithms, and e-commerce companies and technological companies found some way to demonstrate the real benefits. But how it is in pharmaceutical sector? Is it only for experiments for now, or does it have a real benefit right here and now?
I think yes. I mean, we currently artificial intelligence, and as we said, managing or processing this data is already here. And I think I'm bringing two examples, right? Related to this more personalized or individualized medicine, because we think this is the future of healthcare, right? Really looking what are the individual needs of the patients. And we already do this. We use cell therapies, right? And based on artificial intelligence, we were able to develop certain treatments that is truly individualized for the patient needs. So, for example, we extract immune cells from cancer patients suffering from blood cancer, right? Then we train those cells outside of the body. We always say we bring them to a boot camp to learn and detect the tumor cells, because that's the trick that cancer is using. The immune system cannot detect the tumor cells, the cancer cells. And we bring them back after we have trained them to detect those, and then they really can attack the tumor cells in the body, and this really brings the patient to the status of being healed, right? Or gene therapies, right, with artificial intelligence. And when we know how the genes are working, we can, for example, use this therapy to change or repair genes that are causing a kind of a gene defect, and therefore we can also accelerate the healing and the treatment outcome of those patients. So it's already here and now. That's the first thing when we put the patient into the center. But I also think artificial intelligence or even processing all this data can help us to accelerate research and development significantly. I mean, currently it takes 10 to 15 years from identifying a molecule to have the finished product for the patients accessible. And I think when we already know and can use this data and we can process this with algorithms, as I've mentioned, supported by artificial intelligence, it will help us to design the studies better. We already know if there are certain subgroup of patients that we need to look way more closer or more carefully on that. And we already know in a very early stage, could this work or couldn't this work? So I think we can reduce the time from identifying the molecule to the finished product significantly.
But in the European Union, the Artificial Intelligence Act is already in force, and we already have the European health data space legislation approved, and access to health data is now a massive expense for pharmaceutical companies seeing the drug candidates. And are you sharpening your teeth on European data? Because always the pharmaceutical company are talking about the benefits for patient, but of course it's also the
because now you have to buy those data
Yes.
from
Yes.
the data holders, and you're gonna give Europe will give you this data on the
for
platform.
pharmaceutical sector, not
Right.
you
Yeah,
specifically,
yeah, of
but
course.
for
Exactly. Yeah, I think it's always a little bit it's a little bit looking into what can we get out of it, right? I mean, of course, that we get now access to this data, I think there is a lot of benefits, right? Firstly, if we have this unified system, I think also the patient has access to his or her data, right? I think secondly, the physicians, our healthcare professionals are benefiting a lot from this access to data, because then they have the entire patient documentation, right? As I've said, we can then also use we can accelerate the secondary usage of the data for research and development for the pharmaceutical industries. And I think lastly, we can also manage this cross-border data exchange, right? I think there is always the way to negotiate how this access will look like. I mean, on the other hand, we say, look, if we can, for example, reduce our time from identifying the molecule to the ready-made product, and also we can reduce our costs for development. I mean, currently we are investing between $1 billion up to $1.5 billion to get one compound to the market. If we can get this access and we can reduce our costs related to R&D until we have the innovation on the market, I think this will help the entire healthcare system as well, right? So I think it's a little bit of a broader perspective. So who can benefit, and what is then also the return of investment related to this access to
you
data?
say twice about the cost of system. You said that is now the top of the subject we discuss about healthcare system, not only in Poland. And you say that it's reduce cost of development, but this is the question. If you reduce the price, if you have the reduction of cost of development, then maybe the benefits for patient is to reduce the price of drug.
Could be a potential way, right? I mean, I think to me, it's always a little bit, so in what kind of environment are we currently working in, right? And also what kind of effort needs to be put into the development, right? When I look at the development of the healthcare costs, currently, specifically what the medication contributes, it's literally a smaller part. So we are talking here 7 to 10% of the entire healthcare costs, right? And I think we also need to look a little bit more beyond the pharmaceutical costs, because when I have better treatment outcomes, so it means that the patient gets healthier earlier, has less time to recover, does need less time for follow-ups, right? And then can be reintegrated to the working environment even faster. There is the entire benefit for the society, right? Because it then also addresses the capacity issues that we sometimes face in the hospitals if the patients need to be less or fewer days in the hospitals than it was before. So to me, it's always a little bit looking at the entire package. And this is also what we do with our credo, right? I mean, the credo of Johnson & Johnson, which is really our guiding principles, always puts first the patients, second the employees, and then thirdly, what can we give back to society, and literally lastly, our shareholders, right?
Oh, yeah,
It seems very nice. We will not.
So no cheaper drugs, but better outcomes for shareholders.
I don't say that it's cheaper, right?
Fine.
But I think it's. I mean, of course, we will give it back, but the definition is, what does cheap mean, right? It's always what you're comparing to, right? So this is a little bit what I'm referring to.
Foreign companies often criticize the EU for making it difficult to create innovation solutions, but the HDS itself is perhaps maybe an opposite of this.
Absolutely, and we fully endorse that, right? Because currently, from our point of view, the benefits are have more weight than currently the challenges that we face, right? Because as I've mentioned, the patients are benefiting, the physicians, research and development, meaning bringing the innovation to patients and also this unified access. And we can also establish a different level of security of the data, right? So it's really a little bit more standardized. However, there are also some challenges because, the European Union, we are a community of 37 different countries with 37 different legal frameworks, right? With quite a diverse landscape of data privacy guidelines, right? Systems, and of course also the needs specifically, and also there is always also an investment needed, right? Because we need to streamline and to unify these accesses, which means some technologies needs to be developed so that all of the countries have the same access. And I think the willingness of the European Union is there, but on the other hand, there is no timeline when this should happen. And I think this is currently also a little bit of a stumbling stone that there is no deadline until this has to be implemented. And currently there is still the debate on what would be the next best step. And I think this is also what is currently brought via the media, but also where the entire conversations and discussions are going towards too.
Because we are during our presidency in European Union, and in Poland it's not the subject of presidency, but during this time we have to find some common common statement about the pharmaceutical package and all these things what Kuba already mentioned about the innovation. And of course, we could say it's that everybody wants the good for benefits for patients, but after, why is some I don't want to use the word conflicts, but this is a conflict now in European Union about the innovation and what to do.
And it's truly is, right? Currently there are, because also of the geopolitics dynamics that we currently see, right? There is the need to make certain trade-offs, right? And where to go and what to do. On the other hand, I say, look, if you have a healthy population, it's also a very important factor for the entire economy to thrive. And we see this here in Poland, right? Poland is such an important partner for the European Union. We also see now with the presidency, right, how Poland can positively influence certain debates. Poland is growing twice as other countries in the European Union, right? And I think also Poland is in a very good position related to data processing, right?
Why?
Because I think that the knowledge is here in this country, and this is also seen how you see international companies are coming more and more to Poland and building their international and global hubs here, like we do. We see currently we are investing a lot in our R&D hubs. So we have the biggest team outside of the US running the clinical studies, because we know the way how Poland is already processing the data is advanced compared to other countries, right? We see there is a high knowledge related to IT, information technology, big data processing. So we are building here, for example, a global cybersecurity hub. We have the global regulatory hub here, and Johnson & Johnson is growing and is becoming a very important partner to create job opportunities here in Poland. So, but I know currently with the geopolitical situation that we are facing, it's fully clear that there has to be certain priorities. But still, I hope that healthcare still stays a top priority, because if you have the right system in the place, if you can treat the right patient with the right treatment at the right time, it also benefits the entire wealth of an economy.
So COVID pandemic and current geopolitical debate is very, very tough, I think, for everyone, and it's tough to find a consensus, a tough nut to crack, I'd say, for the member states. I think the COVID pandemic shows us how dangerous the rupture of drug supply can be, and how patients can be hostages of
the conflict of the
geopolitical conflict, right?
Let's leave it at that. And I think the tense global situation that we have right now is somewhat reminiscent of Cold War era, and could be troublesome for pharmaceutical companies which rely in many parts from when it comes to API from Asia, right? So how do you try to mitigate that risk, this long-lasting tension around the world?
Yeah, so I think currently what we see, and I think this is also where we are working on, is right that we keep Europe competitive, right? And I think there are certain elements that we need to consider. So from our point of view, it's very important that we still can bring innovation to the patients, right? And this means that, for example, we need to find an agreement with the respective governments to stay back from austerities, which is really limiting to bring the innovation to patient. I think also secondly, we have now a good debate along the IP, so the intellectual property. So what does it mean, right? Is it really beneficial if this is shortened versus other regions of the globe? Because international companies then think it's still worthwhile to invest in the European area, in the European region. And I think these are, for me, critical conversations that we need to have, and we need also to drive, is not stopping the way to drive and to bring the innovation to our patients. Currently, we have R&D hubs here, research and development hubs here. We have production sites in the European Union that are contributing also significantly to the respective GDPs of the countries where we are having those production sites. And I think, to me, that's the most important thing, right? To really, how can we further improve and broaden this access for innovation?
When it comes to pharmaceutical package, I think member states want to do everything right, which is impossible, right?
Exactly,
we want to deal with the long-standing practices which are considered dangerous from the safety or point of view of the EU member states, like the dependence of production of active substances from Asia. And on the other hand, we want to stimulate the development of new molecules, antibiotics, and also have a thriving biotechnology sector. It's impossible to find the consensus here.
Yeah, it is. It's all about, I think, to my point of view, a little bit setting the priorities, right? So what do we want? What do we want to achieve, right? And when I look into the conversations, bringing specifically the IP for the intellectual property here, right? So, is it right that, for example, pharmaceutical companies do have 7, 6, or 10 years of intellectual property protection, right? The other thing is, what is innovation worthwhile, right? I mean, if I can now change a disease from a death sentence to a chronic disease, or even go towards healing this disease, I think these are, for me, the conversations that we need to have, right?
But do you know, because we listen all the arguments from the both sides, and not only two, but different sides, and I always have feeling that everybody use very nice words, but after all, every business is thinking about his interest, and this is this is sad.
Yeah, I think to me is, of course, I mean, the pharmaceutical industry, I mean, we need to generate our profit, right? Because what we gain is we reinvest once again into R&D. I think what I have experienced now with in the past when I had this conversation with certain governmental officials or representatives from certain institutions, that they see us the longer the more as a partner, because they see us really willing to improve the current situation that we face with healthcare, right? Because people get older, right? So we need a different way of treating those people. We identify diseases that haven't happened 100 years ago because the people never reached those stage of age, right? So I think to me it's all about the communication and driving this dialogue and shaping the debate around that. What can we do together? And of course there has to be trade-offs made on both sides. But to me it's literally what else can we do to really make one piece or one person the winner, and that's the patient, right?
But in this context, I have a question, because what is the main problem, the geopolitical situation or the money? Now we're talking about the healthcare system. What is the biggest problem?
Well,
or both, maybe.
Well, I think, I mean, it drives a little, one drives a little bit the other, right? And as I've said, everything is now about to make the trade-offs, right? And how can we really bring the solutions? And coming back to the EHDS, right? It's all about if we can get this access, and I've said if we can really process this data, and if we can get the help from the artificial intelligence, it helps also to managing the costs, right? And I think this is a little bit the way for me to proceed further. So I think it's not either or, it's more what can we do, or how can we best address the current situation in which we are in true partnership, and also having the true debate on how we can address this.
Yeah, but before you said a lot about personalizing treatment of as much as possible, which sounds like a great investment, but it also sounds like a very significant cost to the reimbursement budgets.
I think it's to me we should look a little bit more on a long-term horizon, right? Of course, in the first step, you need to invest, right? You need to develop this treatment. We need to establish a certain system where we can go with this personalized medicine. This is, of course, an investment that we need to do on a short term. But I think on the long-term run, when we can go towards this personalized medicine and we can start to go towards cure of cancer patients, for example, that had a death sentence a couple of years ago. I mean, in the meanwhile, when I look how it goes, let's take the example of lung cancer, right? Talking to specialists, they say, look, when I had a patient that had lung cancer, I knew that the patient will die within 2 or 3 years. In the meanwhile, those patients have way better possibilities to survive even longer. The treatment is way more tolerable. So this means that the patients have way less side effects, which also reduces co-medication, for example. And I think this is a little bit the way we should go. Of course, here and now, we talk of investments, but on the long run, it will help us, right, to reduce the general healthcare costs that we see currently, like capacity issues in the hospitals, long times in the hospitals, we can shorten them, recovery times will reduce, and as I said, also the reintegration into the work is then better done. And I think at the end
argument is that the personalized treatment will be always more cost-effective than regular treatment, right?
It can be, right? We are still at the very beginning, but currently it literally looks like that, right? Because if I really can adjust the treatment to the individual patient's needs, then the outcome will be better. right? And I think on the long run, it will help us also to manage the healthcare costs. Yeah.
And you have a global experience when it comes to the pharmaceutical market. And what do you think, what solution used in other countries could be adopted in Poland to improve the efficiency of the healthcare system? Because you already said that it's different needs, different mental use, and different healthcare system, legislation, and the budget, of course, and the market of the pharmaceutical companies. What if you could compare of these things? What do you think?
So, I mean, firstly, I start the other way around. What can other economies learn from Poland? Because, as I've said,
Better than us.
as I've said, I think Poland is really one of the leading countries currently related to data processing, and I think even having now this so-called drug program where all the innovative drugs are registered and patients needs to be registered, I think that's really leading how it should go, right? Related to the data generation, but also how we are processing the data, and what kind of technology is used, right? Like with this internet-based patient accounts, etc. This is unique, right? I mean, so. The other element where I was, when I joined Poland here, I was a little bit surprised by two things, right? So the first thing is the long waiting time from getting EMA approval until we have the innovation reimbursed here in Poland. So we are talking here literally 800 days on average, compared to other countries on average 500 days, right? So patients are waiting longer until they get the access to innovation. There is currently a lot of things going on, and I think a big progress has already been made with now the new reimbursement law, where also the Minister of Health says, look, from the approval of the European Medical Association to reimbursement, we want to do this in 12 months. This will be a huge achievement. And also the time of negotiation limited to 30 days. It's a big step forward. And I think we are on a good path, right? So that's the first thing. The second thing is, and we talked about the money, right? The investment, when I look where Poland is, this thriving economy, this very important partner for the European Union. But when we talk about the average access to healthcare compared inhabitants and access, then Poland is a little bit at the lower end compared to the other G4 or big economies that we have in the European Union. And why is that? Because those countries are still investing a little bit more from the GDP than what Poland currently does. Currently, we are around 7%, while other economies investing 9%. It's a question, right, where to set the priorities, but I think also here is an opportunity to broaden the access of innovation and also bringing Poland to this position where Poland should be.
Thank you very much for this interesting conversation.
Thank you for asking all those great questions.
Dziękujemy i zapraszamy do oglądania kolejnych odcinków Miodowej 15.